wait a few minutes for everyone to come on. Hello, Hussein. Hello, Akbar. Hi, Dennis. Hope you're well. Enjoying Vegas. Hi, everyone. Oop, I was about to drop this. Hi, Shohre. So, hello everyone. Welcome to my live. Oh, Dennis, you came back. Ah, that was so nice of you to go. What great videos. I've been following you guys like day and night. Everything you're doing, I've been watching. I miss Vegas. I went there, God, I don't know how many years ago now. I think about 10 years ago was the last time I went to Vegas, and I had the best time. And I can't wait to go back. Vegas, LA, New York, 3 of my favorite cities in the whole world. Oh, that's nice. It's so good you got to see Neda. That's so awesome. So, guys, today I have got a real treat for you all. I wanted to come on. It's Wednesday morning here, 9 a.m. Wherever you are, it might be night, it might be day. I just wanted to come on today and bring on someone really, really special to me. And I think you guys are going to get a lot out of her as well. I'm going to bring her on in a minute. She is an awesome physio and a women's health professional. She's very highly qualified. When I went through my pregnancy with both my kids, I was looked after by her, and then I got to see her, and I did she runs Pilates classes as well for mums and bubs. So me and Nila went to that. So she's got a lot to offer, and guess what? She's my sister. So we are very lucky to have her in the family, help us all out. So I thought, what's it? Guys, I'm gonna just say a couple of words in Farsi. دوست عزیز ایرانی، امیدوارم همتون خوب باشین. ببخشید این لایو قراره به انگلیسی باشه، ولی یکی دیگه به فارسی هم میذارم. بعد سبا رو میارم، اسمش سباست، فیزیو که در موردش صحبت کردم، خواهرمه، فیزیوه و وومنز هلت پروفشنال، تخصص تو نمیدونم به فارسی چی میگن، هلت خانوما تخصصم داره. میخواستم بیارمشون آشنا بکنمتون باهاش، ولی یه زوم دیگه به فارسی دوباره، یعنی یه لایو دیگه به فارسی دوباره میارمش دوباره. So guys, I just wanted to explain that in Persian to my Persian friends that this live is going to be in English. I'll have another one in Farsi later again. So her name is Saba, physio. I'm going to bring her on now and introduce you guys to her. Give me one tick. Where are you? Come on, join us. Ah, there she is coming now. Thanks, Dennis John. Hello, hello, hello. Saba.
Hey, sis.
How are you today?
Amazing. How are you, sis?
Good. Good. So I just wanted to give a little bit introduction before you came on. I told everyone who you are and what you do, but and also I told everyone that we're going to have one in Farsi as well, but this one's got to be in English. So I know we've got a lot of people viewing this that are Farsi speaking only, but we'll do another one there. So I just wanted to introduce you to everyone, which I have. So why don't you go ahead and introduce yourself as well to my followers, so that they know exactly all your qualifications.
Okay. Hello, sister and sister's followers, and also my patients who are watching as well. First of all, thanks, sis, for the really sweet introduction. I'm really, really happy to be of service to the family.
We're happy to take the service.
Especially yourself and your beautiful baby Neela, who I call my baby now as well. So yes, as you mentioned, I'm a physiotherapist working in Brisbane, Australia. I work kind of in a city area. I've been a physio for about 13 years now, and despite the challenges that being a health professional has, I love it. I love the hard work, and I love that I can make huge differences to people's lives every day.
Yeah, I know a lot of our friends and family come and see you. A lot of people, our mutual friends, and everyone who knows about you comes and sees you. So you started your own business. How long ago was it now?
So it's about 2 years ago. So in October, it'll be, officially 2 years.
And so she's been jam-packed since then. So normally a business starts and, but it takes off the ground slowly and, you accumulate patients. For her, it was hit the ground running. So as soon as she opened up, she was booked out. So she had to open up more days, more than what she had expected to open up. So you're over at West End. Which street? What's your address there for our Brisbane?
So I'm over at 3/24 Beasley Street, West End. So it's just one of the side streets of West End. I'm located at the Power Hub and Aesthetics Clinic, which used to be called Peaches by Dr. Power, but they've changed their name recently. So it's a beautiful aesthetic clinic with my beautiful friend Dr. Power, and I lease a gorgeous room here where I practice out of.
That's awesome. So we'll I think what we should do is once we have a bit of a chat, then towards the end maybe you can give us a walkthrough around your clinic there and everyone can see what it's like, and also how easy the parking is, because I myself, the minute I heard West End, I was like, oh my god, is there going to be parking issues? It's such a nice quiet street with plenty of parking, so you can just come in peace and quiet. And there's a nice little cafe right next to you guys, which is really cool.
Yeah, so lucky. So yeah, the Good Cafe, which is just amazing. It's called Good, yeah, very cool. Hey, and their coffee is good. I'm drinking it right now.
Oh, that's
yeah, so
nice.
very lucky. And there'll be a bar soon as well. They're almost done with their renovation, so there'll be bar offering food and alcohol, and continues to offer coffee.
Yeah, that's awesome. Go get your physio treatment and then go for a drink, go for a food, for lunch or whatever. That would be nice.
Why not?
So what I wanted to ask, so we're going to have this one, guys, is going to be a shorter live because it's morning here, 9 o'clock in the morning, and Sabo's got patients lined up for the day, which are going to come soon. So we wanted to have just a quick sort of 15-minute one, bit of an intro, and just one question today, but we'll do more. And if you guys have questions like physio questions, health problems, things you want to sort of physio related or women's health related that you want to ask, send me a private message with your questions, and we can line them up for next time we get to grab some of Saba's time. We'll pick her brain about some of this stuff and you guys can get your answers. Definitely. So what I just wanted to ask today is what are maybe one or two of the most common problems that people come to see you about and that you treat?
All right. So probably the most common two, I'd say, is back pain, especially low back pain, and women's health problems. So I guess what you end up seeing more of as a physio depends on what your passion is and what your specialties are and what your ongoing training is. And I guess with my 13 years of experience in private practice, it's probably the most common thing all physios treat in private practice. And then with my further training in women's health and pelvic floor physio, I end up seeing a lot of mums and a lot of women with all kinds of problems such as incontinence and pelvic pain.
So with the lower back pain, do you see that mostly with men or women or both equally? Because I suffer from that a lot, but I don't know whether do men kind of suffer a lot from that, or did they get more upper back pain or shoulder pain?
To be honest, it's quite 50-50, but what tends to happen is women tend to come in when they have pain, because the nature of women is that, you know, we have a problem, we talk about it, we go, okay, my back hurts, or I'm feeling sad today, or whatnot, and we tend to seek help more quickly. So what tends to happen in private practice is we see more women with back pain, but that doesn't necessarily mean that there's not men out there with back pain. What the presentation usually means is that the women come in, they've got a niggle, we get on top of it, they get better, which is amazing. The men come in and they're kind of, you know, limping and bent over because they've waited so long, and their partners or children are like, go get help. So it's quite 50-50, but I do tend to see women seek help first before men.
It's so typical of men, isn't it? Like they always put sort of, when it comes to taking care of their own health, they just, you know, be like, nah, it'll be okay. I know my hubby comes and sees you, and it took some time for, you know, to just keep reminding him that he needs to make time for himself to come and see you, to then finally get in a routines. But now he comes and sees you, and he got you did needling last week for him, right? Like dry needling.
And some
that
hands-on
helped
stuff.
him a lot.
Good. It's
and
quite common. Men sort of put sort of a brave face on, but it's, I guess if I was to give one advice to men, it's not weak to seek help. It actually shows your strength. So seek help, get better, because just like I tell women as well, if you are the best version of yourself physically and mentally, then you can be the best version for everyone else around you. You're stronger that way, rather than waiting till your body breaks down and you're bedbound for weeks on end.
Yeah, that's it. And you also see a lot of sports people, right? Like men who are athletes, and you help them out too.
Yeah, absolutely. Like you know, like guys who play soccer, who do running. Previous clinics I worked at, I saw a lot of rugby guys as well. So it sort of depends where you work, who you track, but I've seen all sorts of sports injuries as well in men and women.
What sort of injuries do they get? I did say I'm going to ask you one question, but it ended up being a few more. So what sort of injuries do the sport people get?
Okay. I'll give you, I guess, an example of what I see a lot, like martial arts, because I have a passion for martial arts myself. So often with, say, karate, for example, you see a lot of like ankle sprains and hip dysfunction. So like they might come in and go, oh, I just want to kick a little bit higher, but I'm getting this like pinch or catch in my hip or pelvis, getting back pain. So yeah, you might get some of those chronic niggles that are getting in the way of their performance, or you might have something really acute where they come in and go, I was doing a kick and I just rolled my ankle, and now I'm limping with a really swollen, bruised ankle. Help me.
Yeah, that makes sense. And you'd be very familiar with that since you've done karate all your life yourself as well. You'd be familiar with what.
Definitely. I love
cool.
I love seeing it.
Yeah. I can tell that your room smells really nice because you've got something on there where we can see the steam in the camera.
I'll show you. I know it does smell nice. So it's kind of where I've rested my camera, but I'll show you guys. That's my beautiful diffuser. It's lavender today. And
Nice.
I just find like a big part of physio, actually, you'll notice you go to a lot of private practices, it's very clinical and really rough and sporty looking. But the reason I chose this place to lease from is that it has a very beautiful aesthetic look. It's like you're going to a spa, but you're not paying any extra You're not paying more than you would at your average local physio, but I'm giving you that. I'm trying to give that 5-star experience. You walk in, you know, you sit at reception, there's beautiful music playing. It's not that clinical vibe. It's very nice, chilled. And then you come into the room and there's a, you know, diffuser and a lamp, and it's a very, very relaxed vibe. So people often feel safe to open up and just chill.
That's so important. I loved it when I came there and the way the place feels, because that stuff is so important to me. Last week I put up a post about, I went to a nail place and it was just, service was nice, the atmosphere was nice, it smelled good, there was good music, and that stuff just is so important to your experience wherever you go. It doesn't matter whether, you know, physio or doctors or wherever. Like, you don't want to feel like, oh, this is really tense.
Yeah.
So maybe you can do a walk around for us, and we can, I know you got to go because you got your first patient coming up.
Sure.
Maybe you can do a quick walk around for us before you go.
So this is my room. This is my desk. So I've always got my laptop. You'll notice that I try and practice what I preach, have it ergonomically set up, so less stress on my neck. I've got my high caps machine here, so I do my own payments.
Which, by the way, I copied. I went and got something not as good as that, but similar to that for my laptop. And it's so good.
Nice. Good girl. Yeah. Finally listening to your sister. And then
but also I had a bit of an accident as well, truth be known. It was for your advice, but also the fact that I spilled coffee on my laptop and I realized, oh, this is good for multi-purposes.
It's elevated. Yep. Would have been a better outcome. Look, chocolate is a must in my clinic. I really believe, you know, you have an intervention and sometimes it does hurt, and you know, you're opening up about really personal things, and I think chocolate just makes it all a bit better. So we've always got chocolate, and some weeks it's Snickers, and other weeks it's fancy. Sometimes I'll make brownies. So that's a little side thing that I like to do. I've got my cupboard here, which I stock all my, you know, essential stuff. The physio bed here, and we've got these curtains here between the rooms, but on top of that we've got the door, so it's just that added layer of privacy. And then we're coming out of the room. I'll just take you to the front of the clinic. So we've got beautiful Rhonda over here who works here at we're trying to get our head around the new name, Power Aesthetics and Wellness Hub. So this is the front of the clinic, and as you can see, there's parking here, which I know you mentioned is sometimes an issue with inner city services, but we've got plenty of parking and also street parking. The coffee shop's just next door, as we talked about. And then if we go through here, we've got our Pilates studio / little gym where I run sort of private rehab sessions with patients. And then we've got several rooms, all once again with curtains and doors, so it's nice and private. And when the patients come in, they can just sit here on these really comfy chairs, really chill out, listen to music. They can check out my brochures and cards. And
so cool. Maybe hold it down a bit more, we can't see. Also, you have this cool chair that you sit on every now and then and enjoy.
Yes, the Power family are just incredible. They just keep surprising me. So they recently, after I got back from Bali, provided this amazing massage chair. So this is my lunchtime shenanigan. I just sit and it reclines right back. So this is what I mean, like the whole clinic sits in well with the vibe that I want to create with my patients, which is that calm, happy, relaxed, welcome, private vibe. So no matter who you are, man or woman, religion, culture, doesn't matter, sexuality doesn't matter, you come in, you're welcomed, and you're in a safe, private environment.
Yeah, is so nice. I need one of those chairs in my life.
I think we all do.
Yeah. Oh, that's cool. All right, cool. Well, we'll let you go. We know you got your patient coming up, but are you good with people? If people PM me some questions and we catch up again and go through some of those and they can get some advice from you?
Yeah, sure. They can PM you. They can PM me.
Yourself.
I'm happy to
Yep.
help. Yeah,
And we can
definitely.
address those questions. And for obviously Brisbane people who have access, go see Saba. You will definitely be hooked and you'll want to go again and again. Awesome.
Thanks.
Well, you have a good day. Thanks
Thank
for coming on.
you. My pleasure. Thanks for having me. Thanks for listening, everybody. Have a good day. Bye.
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 So guys, I hope you found that to be useful and you got something out of that. So we'll have her on again and we can go through some things. There's some common problems often people ask, and they're sort of, and sometimes people don't even know what things a physio will look after or what things, you know, they have to go see a doctor about. So we can sort of go through those things, and oftentimes it's a case where you start with the physio, and if the physio sees something that is a really big medical issue, then obviously they'll refer you to a doctor. So I hope that was a bit of a treat for you all. Dennis Chan, thanks for coming on. We can't wait to come to California and see you and catch up with you and maybe go to Vegas together. Everyone, I hope you all have a good day. It was good chatting to you all, and we'll talk to you soon.